In this video, I will discuss the topic of jawline creation procedures, which have become one of the most popular trend applications in recent years. It is very popular and in high demand. How can I describe jawline procedures to you? I can describe it as making the jawline more defined. In the process of enhancing the definition of the jaw corners, the approach we will use will depend on your examination results. Now that we have examined your findings, we see you are a young patient, aged between 20 and 40, with no signs of skin looseness or sagging. Typically, the longevity of these filler applications is approximately 1.5 years. So, theoretically, we can offer you two options. The first option is to accentuate this jawline, which refers to the corner of the chin, by moving it forward. I could perhaps illustrate this line in a manner akin to using tweezers, dear friends. We can perform filler applications to enhance the jawline and make it more prominent. Typically, the longevity of these filler applications is approximately 1.5 years. As we use hyaluronic acid-based fillers, they dissolve naturally, so let's assume you didn't like it. I mention this because beauty is a subjective concept. I would like you to be aware that there are substances that can dissolve these fillers. We decided against filler applications and opted for something more lasting. For this patient, we can place implants in the jaw corners as we did before. We have the ability to sculpt a more defined jawline that enhances facial structure. This is certainly a more drastic approach. Since this is a procedure with lifelong results, we need to discuss and evaluate it thoroughly before proceeding, ensuring everything is perfectly aligned. We don't have the chance to just say, let's dissolve it like with fillers. We can technically take out this implant, but it does involve a surgical procedure. Thus, I recommend my patients to consider and deliberate a bit more before deciding. Now, we did jawline treatments and are happy with the results. Now I want to talk about something else in a different way. You may have heard about V-line surgeries and V-shape aesthetics, which are patients desiring a V-shaped jawline and lower jawline. This is called V-line surgery in Western sources. Now, in V-line surgery, we may need to do bone resections to shorten the jaw's vertical length. At times, we need to reduce the thickness of the chewing muscle. We need to do some bone shaping. Sometimes, like in this implant surgery, it is necessary to place an implant to clarify that line and make the V shape more distinct. The key criteria here are what? We will conduct an examination. During the examination, we will start by hearing your desires. What do you wish for? What is your request? What do you like? Are your desired things genuinely reasonable requests? We should listen to these first. This means we will allocate time for you. Then we will perform your physical examination. After that, we will examine your X-ray images. Finally, we will combine all this data and make a joint decision. As a result of this decision, should we put in an implant or do a filler? Should we carry out operations such as bone contouring, bone resections, or reducing the masseter muscle to obtain the V-line? Once we reach these decisions together, we will provide you with information about the process, complications, risks, and information on how you will heal, and after explaining all these in detail, we will proceed to the surgical process. In summary, dear friends, today's specific subject is jaw surgery, thus it relates to the jaw. If you have any issues related to facial skeleton surgery, I kindly ask you to know that we will strive to assist you in finding a solution. I hope these videos are beneficial for you. Please remember to hit the like button, follow us, and recommend us to your friends, spouse, and loved ones. I greet you with respect. See you later. Farewell.